How did smallpox affect the Civil War? How did smallpox affect the American Civil War? This question opens a window into a lesser-known aspect of the conflict that shaped the lives of soldiers and their families. Smallpox was a highly contagious and deadly disease during this time. Between the years of 1861 and 1866, the Union Army reported about 12,236 cases among white soldiers. The death rate for these cases was around 23%. The impact was even more severe among black Union soldiers. They faced a staggering 6,716 cases, with a mortality rate of approximately 35%. This disparity highlighted the health inequalities that existed during the Civil War, particularly for black troops who often suffered from poor nutrition and health due to their previous enslavement. Both the Union and Confederate armies recognized the threat posed by smallpox and took action. They implemented vaccination programs to protect their soldiers. Vaccination involved transferring material from smallpox sores to healthy individuals to induce immunity. However, many soldiers were not vaccinated at first. Regiments were raised quickly, and vaccination regulations were not strictly enforced. Many recruits had never been vaccinated before the war began. To control outbreaks, armies used quarantine measures. Infected patients were isolated in separate hospital wards or facilities. Contaminated clothing and bedding were destroyed to prevent further spread. These efforts helped avoid large-scale epidemics within the ranks. Vaccination and isolation were the primary strategies employed to limit the spread of smallpox during the war. The Confederacy faced unique challenges with vaccination. Due to shortages and difficulties in maintaining vaccine quality, some Confederate soldiers received ineffective vaccinations. These spurious vaccinations sometimes caused harmful side effects, including skin infections. This was often due to inexperienced medical personnel and poor vaccine handling. Despite these issues, proper vaccination remained beneficial when administered correctly. Smallpox also influenced military recruitment and readiness. Fear of the disease discouraged enlistment in some areas. Outbreaks could temporarily reduce the fighting strength of units. The Union's vaccination efforts, although not perfect, helped maintain troop health and contributed to military effectiveness. The success of vaccination campaigns during the war encouraged broader civilian vaccination efforts after the conflict ended, helping to reduce smallpox cases in the general population. In summary, smallpox was a serious health threat during the Civil War, causing significant illness and death, particularly among black soldiers. Vaccination and quarantine were key strategies used to combat the disease, though implementation varied and faced challenges, especially in the Confederacy. The experience with smallpox during the war advanced medical practices and public health measures in the United States.